Hello everyone, I'm Dr. Monica. In today's video, we'll be exploring the clotting cascade, a crucial process that helps stop bleeding through a series of clotting factors and pathways. So let's first understand what is coagulation. It is a complex process by which blood forms clot. It's an important part of hemostasis, which is to stop the bleeding or hemorrhage. Hemostasis, it has three stages: primary, secondary, and tertiary. So let's first understand the stages of hemostasis. The mechanism of hemostasis occurs in 5 stages. The first phase is the vascular phase, where there is constriction of the blood vessels immediately after injury. Second phase is the platelet phase, where there is formation of temporary platelet plug. Then we have is the coagulation phase, where there is activation of the coagulation cascade. Fourth phase is the clot retraction phase, where the blood clot contracts, followed by clot destruction phase, where there is enzymatic destruction of the blood clot. So this diagram represents the first phase of primary hemostasis, where we can see that this is a site of injury, where we can see that endothelium lining has been broken and the extracellular matrix or the collagen, they have been exposed to the blood vessels, and we can see that the endothelium, it releases endothelin, which is causing vasoconstriction within the first 30 minutes of damage to the blood vessels. So this diagram shows the second phase of hemostasis, where there is aggregation of platelets to form soft platelet plug at the exposed endothelial cells at the site of injury. So let's briefly understand the overview of the coagulation cascade, which is a part of secondary hemostasis. Coagulation cascade comprises of intrinsic pathway and an extrinsic pathway which converge at a common point, that is common pathway that activates fibrinogen into fibrin, which is a soft clot. It is not stable initially, which is stabilized by activated clotting factor number 13 to form a hard clot. So let's briefly understand the overview of the coagulation cascade, which is a part of secondary hemostasis. Coagulation cascade comprises of intrinsic pathway and an extrinsic pathway which converge at a common point, that is common pathway that activates fibrinogen into fibrin, which is a soft clot. It is not stable initially, which is stabilized by activated clotting factor number 13 to form a hard clot. The intrinsic pathway comprises of various clotting factors, including factor 12, which is H-man factor, factor 11, which is plasma thromboplastin antecedent, factor 9, which is Christmas factor, factor 8, which is antihemophilic factor A, factor 1, which is fibrinogen, factor 2, which is prothrombin, and factor 10, which is Trot power factor. Whereas the extrinsic pathway, it is activated by clotting factor number 3, which is tissue factor, clotting factor number 7, which is stable factor, along with factor number 1, 2, and 10. Whereas the common pathway comprises of factor number 1, 2, factor number 10, along with factor number 5, which is labile factor, and factor number 13, which is fibrin stabilizing factor. Let's first understand the intrinsic pathway of the clotting cascade. This is a longer pathway and it begins when the H-man factor, which is clotting factor number 12, in its inactive form comes in contact with the collagen from damaged blood vessel wall and it gets activated into 12A, which is now an active enzyme. Now 12A, it activates factor 11 into 11A. Now factor 11A, it activates the inactive factor number 9 into 9A. Meanwhile, factor 2A activates inactive factor number 8 to active factor number 8A. Finally, factor number 9A along with factor number 8A combining with calcium activates the inactive factor number 10 into active factor number 10A. Now let's understand the extrinsic pathway of the clotting cascade. This is the shorter pathway and it works within seconds. It starts when there is an injury to a blood vessel. In response to this, the damaged endothelial cells they release tissue factor, which is clotting factor number 3. Tissue factor then activates stable factor, which is clotting factor number 7 into clotting factor number 7A. Now, tissue factor along with factor 7A go on to activate inactive factor number 10 to active factor number 10A. At this point, the intrinsic and the extrinsic pathway join together into a common pathway which leads to fibrin formation, and further it can clot the blood. Now let's discuss the common pathway. Common pathway starts when the clotting factor 10 is activated into 10A. This activation can occur through extrinsic pathway using tissue factor, which is clotting factor number 3, along with 7A and calcium, which forms the extrinsic tinase complex, or it can occur through the intrinsic pathway using the clotting factor number 9A along with 8A, calcium and phospholipid, which forms the intrinsic tinase complex. Once the factor 10A is formed, it converts prothrombin, which is factor number 2, into thrombin, which is factor number 2A. And once thrombin is formed, it converts fibrinogen into fibrin, and also thrombin activates the clotting factor number 13 into 13A, which finally leads to formation of cross-linked fibrin, which is used to stabilize the blood clot. So thrombin plays a key role in the clotting cascade as it speeds up the clotting process by activating the clotting factor 11 in the intrinsic pathway. Also, it activates clotting factor number 8 and 5 in both intrinsic and the common pathway. Now talking about few inhibitors of coagulation. First one is the tissue factor pathway inhibitor. It inhibits the tissue factor and clotting factor 7A complex. Second one is the anti-thrombin 3, which binds to directly inactivate thrombin as well as clotting factors 9A, 10A and 11A. Third one is the tissue plasminogen activator, which catalyzes plasminogen into plasmin. If you have found this video useful, please like and subscribe. Thank you.